a system where we're going to work with your employers to lower your premiums by up to $2,500 per family per year. We will start by reducing premiums by as much as $2,500 per family. Here's what changes, saying to people who already have health insurance and the employers who are providing it, we'll work to lower your premiums by up to $2,500 per family per year. I also have a health care plan that would save the average family $2,500 on their premiums. And if you already have health care, then we're going to reduce costs an average of $2,500 per family on premiums. We're going to work with your employer to lower the cost of your premiums by up to $2,500 a year. And we'll cut the cost of a typical family's health care by up to $2,500 per year. And if you've got health care, we're going to work with your employer to lower your premiums by $2,500 per family per year. And we will lower premiums for the typical family by $2,500 a year. And cut the cost of health care by up to $2,500 per family. And if you already have health care, then we're going to work with your employer to lower your premiums by up to $2,500 per family per year.
Barack's policies will provide health care cost reductions of about $2,500 for the typical family.
It's time to bring down the typical family premium by $2,500, and it's time to bring down the costs for the entire country. And if you already have health insurance, we will lower your premiums by $2,500 per family per year. We're going to work with your employer through a catastrophic reinsurance plan to lower premiums by about $2,500 per family per year.
The only thing we're going to try to do is lower costs so that those cost savings are passed on to you. And we estimate we can cut the average family's premium by about $2,500 per year.
And we'll work with your employer to lower your premiums by $2,500 per family per year.
Barack Obama will provide rural America with affordable health care and save the typical American family $2,500 a year.
And reduces every family's premiums by as much as $2,500. If your employer does offer you health care, then we're going to work with your employer to lower premiums by up to $2,500 per family per year. And cut the cost of a typical family's premiums by up to $2,500 per family per year.
Hi everyone, thank you for joining the webinar today. We're going to go ahead and get started. If you're just joining, I did mention that if you have questions, please type them into the question box as they arise. We won't be reviewing them mid-webinar, but at the end of the webinar, which should last about 25 minutes, we will go ahead and answer those, and I'll stay on for as long as you guys would like me to answer questions. So. For those of you who don't recognize my voice, my name is Rick Lindquist. I'm the president of Zane Benefits, and today I'm going to be talking about the individual health insurance marketplace coming in 2014. It solves, in my opinion, a lot of problems with the individual market. I know that there's a lot of mixed feelings depending on your political viewpoints, as well as your personal viewpoints with regard to health insurance. That may affect what your perception is or what you're reading about when it comes to the individual health insurance marketplace. So in this webinar, what I'm going to try to do is take a non-political view of this individual health insurance marketplace and look at it for what it is. I'm going to make a couple of assumptions. Number one, the first assumption I'm making during this webinar is the healthcare reform bill and the health insurance marketplaces and for the individual marketplaces are going to stay in place. In other words, come October, there's going to be a new thing called a health insurance marketplace in each state, and that's going to exist. So that's the assumption I'm working on. So when you get past that and you have these health insurance marketplaces that are going to be functional in October, and you're working off that assumption, we really do know what to expect come in October from an employer's perspective, from an employee's perspective, and from a broker's perspective, at least within some basic guidelines. So those are the things we're going to be walking through today. I'm going to do my best not to get opinionated, and I'll try to give both sides of the story or both viewpoints. But hopefully you leave today's webinar with a good, clear understanding of the purpose and intent of the individual health insurance marketplace. In other words, I want you to be able to answer the question, what is the purpose of the individual health insurance marketplace? Why does it exist? Why didn't it exist before? And how can it solve a problem of mine? And how does it affect my business? And if you can leave with that, then that should give you enough to go with and start preparing yourself, whether you're a broker, whether you're an employer, or whether you're an employee or individual. So you can start preparing for some new health insurance decision making come 2014, really October of 2013. And the phrase I like to use to describe what the purpose of an individual health insurance marketplace is if you look at the bottom left of this slide here, is helping individuals compare standard individual health insurance options. And I really think that's an important phrase to keep in mind. It's the idea of a health insurance marketplace is to help someone in one place compare standardized individual health insurance options. And really, this doesn't exist today in a one-stop, non-biased format. And I know that's going to, if you're a broker on the call, that's kind of a slap in the face. I mean, I don't mean for it to be that way, but I'll talk about why that's the case and maybe why we can start looking at this health insurance marketplace in a little bit different format. It's not a broker in any way, shape, or form. It's a mechanism. All right, so agenda. Oh, I got to do a disclaimer first. So quick disclaimer. I'm going to be talking about this based on my understanding of the individual health insurance marketplace. I've done a lot of reading about this, and I've spoken with a lot of states, brokers, and experts working in the health insurance exchange space. So I've developed a pretty good understanding of this, but please do not take this as legal advice, tax advice. Go consult an attorney or a licensed tax advisor for that sort of information. But I will be giving you my honest opinion. Whether you agree with it or not is up to you. I'm not going to try to make you agree with me, but hopefully you appreciate the viewpoint and can take something away from the webinar. Quick overview of, for those of you who don't know what Zane Benefits is, just so you know where I'm coming from and what my perspectives may be formulated based on. We provide a software platform that essentially lets an employer get out of the health insurance business. So the primary, a typical customer of Zane Benefits is a 2 to 1,000 employee company that can no longer offer group health insurance due to maybe it's not the best solution, or they can't afford it anymore, or employees aren't participating anymore because the contribution's too high, and they want to give employees money to go buy their own individual policy. So the Zane HRA software platform basically is an online software product that lets an employer in less than 5 minutes per month reimburse employees for individual health insurance premiums. And so employers basically use Zane HRA to offer a defined contribution plan. The employees are going to go out and purchase their own individual policies. Typically, they're going to work with an insurance professional that is a partner of Zane Benefits to buy those individual policies, and then they're going to use the software to get reimbursed from their employer tax-free. So that's an overview of what we do at Zane Benefits. This isn't a sales presentation, so that's pretty much the last time I'm going to talk about Zane Benefits. But if you do have questions about what we do or interested in our services, please feel free to give us a call. Now to the agenda for our presentation today. We're going to walk through the following 5 agenda points. First, what is the individual health insurance marketplace? It's a new term as of 2013. And so what is it? What's its purpose? Why do I care about it? And second, we'll talk about some of the advantage the individual health insurance marketplace brings that maybe are going to be new that we don't have today. 3, we'll talk about the individual. I'm sure all of you are wondering, well, what's health insurance on the individual market going to cost in 2014 with all these changes taking place? While we don't know for sure, we have some ways to estimate the cost and on an individual basis, so we'll talk about how you can do that. Number 4, we'll talk about why this marketplace matters to you, whether you're an employee, an employer, or a broker. There are some key reasons why you want to be educated on this from a solution perspective, because it's going to affect your bottom line, whether you're talking about your individual income or your employer balance, if you're an employer, your balance sheet, or a broker, your balance sheet from a compensation standpoint. This is going to impact your business. And number 5, we're going to talk about how to access the individual marketplace. It's a little bit different than what we're used to in the individual and group health insurance markets. So there's going to be some rules, new rules on this marketplace that limits when and how we can access the marketplace. So hopefully we can get through this in the next 20 minutes and have some time for question and answers. I want to keep this simple, so if you have questions, type them in and we'll hold them to the end. So what is the individual health insurance marketplace? So if you haven't heard the term health insurance marketplace, it's because it's a relatively new term to describe the health insurance exchanges created by the Affordable Care Act. So in March of 2010, the Affordable Care Act was signed into law and called for the creation, starting in 2014, of two types of health insurance exchanges. One was a small business health insurance exchange, and one was an individual health insurance exchange. And every state has to create one of these by 2014. Earlier this year, because of all the buzz around exchanges, the federal government decided to rebrand the health insurance exchange term to health insurance marketplaces. There's a lot of reasons why they may have done this, maybe for public perception, differentiation, but it doesn't really matter why they did it. They did it. So now when we're talking about these exchanges from the federal government's perspective, they're going to call it a health insurance marketplace. But it's the same thing as a health insurance exchange, nothing new here, just a new term. And when we say individual health insurance exchange, health insurance marketplace, the individual health insurance marketplace is the ACA's individual health insurance exchange, which is referred to as the AHBE, the American Health Benefits Exchange. And the purpose, when you read the law and you listen to the proponents of the Affordable Care Act, the purpose of this exchange is to accomplish three basic goals. First, to standardize individual health insurance products within these specific metal tiers. We'll talk about these specific metal tiers in a second, but the idea is create a standard set of individual health plans to allow an uneducated consumer to compare and contrast products based on these levels. And so that's one big purpose of the American or the individual health insurance marketplace. Second, if you listen to proponents talk, they're going to say the purpose of the individual health insurance marketplace is to provide a format for unbiased, and I quote unbiased because this is one of those things that is, you either think it's unbiased or you don't, and you either think we have a problem today or we don't. And so I'm not going to take an opinion on this, but the idea here is that the individual health insurance marketplace provides an unbiased individual plan comparison. In other words, it allows the individual to compare all the plans in one single place without maybe someone or some sort of mechanism influencing the individual's decision. And I'll talk a little bit about that in just a second with an example of where bias might affect an individual's health insurance selection. Third, this is probably the biggest purpose. You could argue that you could standardize plans and create an unbiased plan comparison in a number of different ways without a health insurance marketplace, but the one thing that the individual health insurance marketplace does, and only the individual health insurance marketplace can do currently, as the law is written, is the tax credit administration for premiums. And so when, and we'll talk about this in the presentation as well. So the individual health insurance marketplace, if I had to say one thing that is absolutely crucial that the individual health insurance marketplace provides, it's the determination of the tax credit eligibility on an employee by employee basis. If you're not familiar with the tax credits, we'll talk about that in just a second, so hold tight. And the actual facilitation of the payment to the carrier, factoring in those tax credits. So the exchange is, or the health insurance marketplace is actually going to be responsible for, one, saying, individual, you are eligible for a tax credit in the amount of X. And then actually taking that X and going and getting it from the federal government and making an advance payment to the carrier on behalf of that employee. So that the employee only has to pay out of pocket for their portion of the premium. And this is actually a very huge benefit, no matter how you look at it from an individual standpoint. And we'll talk more about that as we go. But remember, I like this one phrase to describe, the value of an individual health insurance marketplace. helping individuals compare standard individual health insurance options. And you might add a line that says, helping individuals compare standard individual health insurance options with tax credits, with the availability of tax credits. So understanding how the health insurance marketplace works, if you're not in the insurance business and you haven't sold health insurance before and you haven't maybe done your own health insurance purchasing, so if you're an employee of a company that's always offered health insurance, you probably haven't really thought about what a health insurance marketplace would do for you. But this is how I would break it down. Step one, I have basically 5 steps that how the individual health insurance marketplace would work for an individual. Step one, you as an individual are going to go to your state individual health insurance marketplace website, for example, Covered California. And I'm just going to click here and give you a quick look at what this website might look like. And you're going to come to this website, and it's going to you can see here that it's saying 263 days until new coverage begins for millions of Californians. So this is, if you want to apply for individual health insurance starting in 2014, this is the site you're going to come to. Next step. The individual is going to complete one of 2 applications. There's going to be an application for insurance with a tax credit. So let's just say you meet the eligibility thresholds for the tax credits, which we'll go through in just a second. In order to get the tax credit, you're going to have to fill out a longer application. And there's a link to a sample here that we'll walk through. Second, if you're not eligible for a tax credit because of your income, you make too much money, which is a good problem to have, you'll fill out probably application number 2, which is a shorter application. But you're going to fill out one of these 2 applications, only one. Once you fill out that application, the health insurance marketplace is then going to display all available plan options that are available to you. They're going to be based within metallic tiers, and the displayed cost, so there might be 20 options for you. The displayed cost is going to take into account your tax credit. So you know, hey, maybe the premium for this plan is $500 per month, but my tax credit makes it so I only have to pay $100. The insurance marketplace is going to show you what your out-of-pocket costs would be, and that's only going to be $100 in that example. So the key comparison tool here is that it's actually going to show you what your costs are going to be based on your tax credit, and there's not going to be any other mechanism to do that. The only place you're going to be able to do that automatically is on the health insurance marketplace. Step 4, the individual is going to click a button and select the plan that best meets their needs based on maybe a combination of plan design, network, and the actual cost that they have to pay out of pocket. And then step 5, the individual health insurance marketplace is actually going to bill the individual for his or her portion of the premium. In other words, the total premium minus the tax credit. So in that example I just gave, let's say the premium that the carrier is charging is $500 for that individual product per month, but the tax credit says that employee only has to pay $100. The exchange is going to go get $400 from the federal government in the form of a tax credit, and send that to the carrier, and they're only going to charge the individual for $100. And this is a key function, as I mentioned earlier, of the health insurance marketplace. So quick review. Step 1, individual is going to go to the website. Step 2, they're going to fill out one application. If they're eligible for a tax credit, it's going to be a slightly longer application. If they don't want a tax credit, it's going to be a short application. Step 3, the marketplace is going to show them all their options, factoring in the metallic tiers and the tax credit. And the individual is going to select the plan that best fits their needs, and then the health insurance marketplace is going to facilitate the advance payment of the tax credit and the billing of the individual for the remaining portion. So that's how it works in a nutshell, if you were wondering how this thing might work come 2014. So what are some of the advantages? Why would I use the individual health insurance marketplace versus going to, let's just say, call a carrier directly? Let's say I just call Blue Cross Blue Shield directly. Why would I want to go to the marketplace versus calling them directly? And I've outlined 4 key advantages here, and these are not necessarily exclusive to the individual health insurance marketplace, meaning I guess you could have choice in a lot of different fashions without the individual health insurance marketplace, but these are some of the advantages that the proponents of the individual health insurance marketplace are outlining, and I think they're good points. So we're going to walk through each of them. Number one, choice. The individual is going to be able to choose between all available plan options. Two, portability. The individual is going to be able to keep their health insurance independent of employment. We'll walk through all this. Step three, there's an element of a one-stop shop / convenience, no matter what provider you're choosing. And then there's the major advantage of tax credits, because tax credits are only available in the individual health insurance marketplace. So choice. The individuals will be able to choose the health insurance plan that best fits their family needs based on standard metallic levels. And what the health insurance marketplace is going to do is it's always going to be based on these metallic levels. And so when an employee is comparing and contrasting these plans, while there may be choices elsewhere, the health insurance marketplace is always going to do it in a standard way within these metallic levels. So there's going to be platinum, gold, silver, and bronze. And basically, the higher you go, the more rich the benefit, the higher the premium. The lower metallic level you are, the lowest being bronze, the more, the less robust the insurance is going to be. But all of these plans are going to are going to have a maximum of a $2,000 deductible. So you're not going to, it's not like any of these plans are going to be outrageous. Outrageously bare. It's just one's going to, like this platinum plan is basically going to be as close as you can get to 100% coverage at 90%. So once the individual is going to select what maybe category or level, metallic level plan, within each of those metallic levels, they're then going to be able to pick a plan based on what the provider is, whether they want a Blue Cross Blue Shield plan or a United Healthcare plan, whether they want this network versus that doctor network, whether they want a 80% coinsurance versus 100% coinsurance, deductibles and copays. So there's going to be several combinations of plans. It's not going to be like, hey, you've got 4 choices. There's going to be different plan designs. There's going to be the option for the carriers to provide different plan designs within each of these categories. So major choices and advantage. Number 2, portability. And this is, I think, a huge one. And this is not necessarily unique, like I said, to the individual health insurance marketplace, but it's a huge advantage of individual health insurance in general. So individual health insurance is not tied to employment, meaning they will be able to take their health insurance with them when they switch jobs. An individual who buys an individual policy has an advantage over someone with a group health insurance policy, because if they get too sick to come to work or they switch jobs, they don't have to go through the issue of searching for health insurance as they switch jobs. They keep their health insurance with them. So I like to think about this as the portable memory analogy. And now a lot of us have our files and our information stored in multiple places. So it's almost like infinitely portable. But when these thumbsticks came around and you could take your Word documents and your Excel files with you on these thumb drives, it was extremely convenient, and also less risky to a certain standpoint, because you'd have your health insurance with you at your information with you at all times. So I like to think of individual policies as a portable memory stick versus having that home-based computer that if your home catches fire, all your data is lost. Whereas your portable, your memory stick goes with you. So think about individual health insurance that way versus group health insurance. Major advantage for an individual, assuming that the health insurance prices and value are the same between the two types. Number 3, one-stop shop / convenience. So one website and one application is going to get the individual access to all available plan options within that health insurance marketplace and the premium tax credits. That doesn't exist today. There's nowhere that you can go. You fill out one application, you get access to all available plan options in the individual marketplace, and you have the availability for premium tax credits. So this is a very big, unique advantage. And I'm going to take the proponents, put the proponent's hat on for a second, and say, best of all, it's going to be unbiased, unlike sites like ehealthinsurance.com. So a lot of people are arguing this health insurance marketplace already exists. Look at eHealth Insurance. Well, there's a key difference between the individual health insurance marketplace that we're talking about today and eHealth Insurance. eHealth Insurance is paid based on commission. So when you go to an eHealth Insurance site, you may see a list, and for those of you who don't know what eHealth Insurance is, it's basically an online quote engine and comparison tool for individual health insurance. And it's been available for many, many years, and it's actually where I buy my health insurance from. Excuse me. But they're a broker. And so when you go online to eHealth Insurance, when you type in your zip code, they actually have algorithms that take into account what the plan that you're most likely to buy the quickest is and what they're most likely to receive the most profit on in terms of compensation. So part of the eHealth Insurance website, when you go in and look at plans, is matching you with the plan that is most profitable for eHealth because they're a private company and their health insurance or their business is based on maximizing their health insurance revenue. And that's the bias that I'm talking about, whereas the health insurance marketplace isn't going to have that. Finally, tax credits. There's a special incentive. So if you didn't know what tax credits were and you've been waiting for me to get into it, here it is. Excuse me. Massive tax credits will be available for households earning up to 400% of the FPL starting in 2014. We'll talk about what that looks like in terms of income in just a second. The FPL stands for Federal Poverty Line, if you were wondering. And the key thing is individuals can only access the premium tax credits to the individual health insurance marketplace. So if your company currently offers coverage, it requires that employer, it may require that company or your employer to drop coverage in order for you to get access to these tax credits. So that's a major, major advantage. So here, I mentioned I'd get into what the tax credits are, but here's a quick overview. The premium tax credits essentially cap as a percent of income an individual or household's health insurance costs based on where their income lies on this chart here, on FPL. FPL is Federal Poverty Line. It's calculated every year. So in 2014, there'll be a new one. But these are the numbers for 2013 that will be adjusted next year based on I believe it's inflation. But looking at this chart will give you a great idea of where you may fall, or where your employees may fall, or where your clients may fall come 2014. But the key thing to remember is the tax credit is not a fixed amount based on your income. It actually is variable based on the premium that the carrier is charging. It doesn't cap the tax credit, it caps what you pay. So let's walk through an example here. If I am a single individual, I am the FPL for 2013 Federal Poverty Line is $11,490 per year. And if I make less than $50,000 or $46,000 approximately, $45,960, then my premium, the max that I can be required to pay out of pocket, is $0 to $363.85 per month. So, what does that look like in terms of a tax credit? Well, it depends on what the health insurance premium is. If the health insurance premium is $1,000, my tax credit may be as much as $1,000 if I have a $0 premium cap. So even if the premium in this case is $1 million, the most I'm going to pay is $363. The federal government is going to kick in the rest in the form of a tax credit. And that's the key distinction. A lot of people don't get that. So how valuable are these tax credits? Well, one way to look at it is comparing what people who are eligible for a tax credit will pay on the individual market with what people have been paying on the individual for similar coverage on the group market. And if you look at the average group premium, meaning assuming your company offers you employer-sponsored health insurance, excuse me, in 2011, the average premium was $435. So if you really factor in all the rate increases since 2011 and into 2014 times, you could say it's like $500. So the max that anyone is eligible to is going to have to pay on the individual market is going to be $363 within this FPL. So that's a $150 savings comparing $500 or you just leave it at $435, nearly $100 savings compared with individual compared to group. If I look at employee plus one, which is a household of two, say I'm married but I have no kids, my range would be $15,000 to $60,000, and my premium cap range would be $0 to $491.15. If I'm making $40,000 with a house with a couple, I'm going to be somewhere in between here. Look at this number, $860. If I apply the rate increases from 2012, 2013, and 2014, I'm probably up to $1,000 next year. Compare that to $491, another 50% savings. So I could get a much better deal potentially on the individual market, factoring in this tax credit, than I could on the employer market, on average. And then I look at the family of four in 2011, and these are all based on the Kaiser family study that comes out every year, was $12,051. So let's just say in 2014 the average cost for family is going to be $15,000, and this is per month. Go to the chart here, household size. If I make less than $94,000, 2013, my health insurance costs are capped at $745.75. If I make $60,000 family of four, I'm going to be somewhere in between here. Look at that, 50% to 40 to 50% savings again on health insurance. And so what I guess the point here is that these tax credits are a major advantage, and because they are only available on the individual health insurance market, and more specifically, only available in the individual health insurance marketplace, this creates a massive incentive for individuals and employees and brokers and employers to purchase coverage through this individual health insurance marketplace versus however they're buying health insurance now, especially if your income falls in between one of these charts, one of these ranges. So individual health insurance costs in 2014. That's a common question that's floating around. How much is my health insurance going to cost in 2014? Well, we don't know. It's going to depend on a lot of factors, and we probably won't know until around October. So it's TBD. But if you fall in between those 100 to 400% FPL lines, you can estimate your cost using a tax credit calculator. Most of the exchanges or health insurance marketplace websites are up, so you can go to these sites and calculate it. So here's Covered California Cost Estimator. So this is what it will look like. It will ask you what the number of people are in your household size, what your annual household income is, what's the youngest adult in the family. It'll estimate your premium without the subsidy, but that doesn't matter to you because remember, your premium is capped as a percent of your income. It'll estimate the tax credit, and it will estimate your actual out-of-pocket premium. So let's go actually take a look at this for a second. We can actually type in an example. So let's just say I have a family of four. My household income is $50,000, and the youngest person in my family is 10 years old. My estimated monthly premium is $280 because that's what the government says my max payment is. The government's going to kick in the rest, but because they don't know how much this is going to cost me come 2014, they have an NA here because they can't calculate it. If I type in, let's just say family of four, 40,000, look at that, it takes down my estimated monthly premium to 164. If I go up to, let's just say I make 100,000, look, it's NA, I don't know yet. It's going to depend on factors that we don't know yet. So, but if you're within that 400% of FPL, you know exactly or roughly what your costs are going to be based on the FPL for 2013. So I thought you'd find that interesting. All right, so back to this, we'll wrap up. So why the health insurance marketplace matters to you. If you're an employee, if your firm does not offer health insurance, you may be eligible for a tax credit starting in 2014. So you may be able to, one, purchase health insurance because you can't afford it today, or two, you may be able to save money on your existing individual health insurance policy because of the tax credit. If your firm does offer health insurance, you may be able to get equivalent individual health insurance for less money with portability. Here's the other side of the argument. If you currently are very healthy and very young and you make a lot of money, let's say you're paying $100 a month for your premium, you're probably going to pay more than you pay now because you're not going to be eligible for a tax credit that subsidizes your premium. In that case, you may be worse off. But the majority of Americans, as I mentioned before are going to be eligible for these tax credits. So you may be in a situation where your company does offer health insurance, and individual health insurance of the exact same plan will be less money when you factor in the tax credit. So it may be better for you to drop off your employer's plan and go purchase an individual policy with a tax credit, and the advantage would be that portability that we talked about. Employers. And this is the equation I like to ask people. Does individual health insurance in the health insurance marketplace come 2014 plus defined contribution equal better benefits for less? In other words, will it be a better solution for an employer to cancel group coverage, give employees money to go purchase their own health insurance, and let the employees get the tax credits? It's going to depend on your company situation, but if you have less than 50 employees, it's likely that this solution is going to be less money, cost less for you when you factor in the tax credits. So insurance brokers, that brings me to you. The broadest way to look at the individual health insurance marketplace is that it's a new solution to offer employers, employees, and individuals. So it's a new way for you to offer coverage. It addresses one of the major problems with individual health insurance coverage today, which is that it's not guaranteed issue. So it's going to be a lot simpler to implement when you have a client that needs health insurance. And then also in many states, such as New York and Washington, the health insurance marketplaces are allowing the same commission that you're used to receiving on the individual policies today to be paid directly from the carrier. So your business should not change too much just because a policy gets sold in the health insurance marketplace, depending on, assuming you're in one of these good states. And if your state's not doing this, point to New York, point to Washington and the other states doing this, and start getting them to make these changes. Either way, I guess the negative for a health insurance broker is that you could view the health insurance marketplace as a competitor, but I don't think that the health insurance marketplace will be able to provide the advice that a broker will be able to provide, especially in person. So just to give you an idea of that individual insurance plus defined contribution idea, if you're an employer, an employee, or a broker, you're going to want to be thinking about, hey, is it cheaper for individuals, for these employees or individuals to buy health insurance on the individual marketplace? If so, how can we keep the employer involved in the health benefits game? The defined contribution solution is one way to do it. So here's an example of a screenshot that might work. The employee logs in, they see their HRA money. This is the money that the employer is giving the employees to purchase individual coverage. They can see what's eligible, and then maybe you provide a link to the health insurance marketplace. And if you're a broker, maybe you have a website that integrates with the health insurance marketplace so that you can get credit for the sales and actually be available to assist employees when they have questions. So just some food for thought here. Last slide, accessing the individual health insurance marketplace. You can only access coverage in the individual health insurance marketplace during designated enrollment periods. So this is a limitation of the health insurance marketplace. So what I mean by that? It means that basically there are 3 ways that you can enroll in coverage. There's a one-time initial enrollment period that happens this year, and it starts October 1st, 2013, and goes through March 31st, 2014. During this initial open enrollment period, you'll be able to sign up and get coverage effective for January 1st, 2014. But this is a one-time thing. After this enrollment period, the only time you're going to be able to apply and enroll in coverage is during an annual enrollment period that happens once per year from October 15th to December 7th. If you want health insurance and if you fail to purchase health insurance in this initial open enrollment period before March 31st, 2014, and you want to buy coverage in April 1st, 2014, you are out of luck. You are not going to be able to get health insurance until the next open enrollment period, unless you qualify for a special enrollment period. And what these special enrollment periods are is they're very similar to cafeteria plan rules. Basically, if you lose health insurance due to no fault of your own, or you lose, or maybe you change jobs, or your income changes that makes you eligible for tax credit, those are going to qualify you for a mid-year enrollment period for a period of 60 days to purchase health insurance. But if you don't purchase health insurance within that special 60-day enrollment period, you've got to wait till the next annual enrollment period. So you're probably wondering, why enrollment periods? And the reason is really simple. one of the big benefits of healthcare reform from a individual's perspective is that guaranteed issue health insurance takes place. So now, no longer can you, starting in 2014, you go to an individual policy carrier and get denied coverage. They have to accept you. But when you create that sort of rule, a lot of people would make the decision to just go without health insurance until they need it, because they could just wait and then go buy health insurance when they need it. So the problem with that is all the sick people buy health insurance, all the healthy people don't, and health insurance becomes unaffordable. So the reason we have enrollment periods is to protect the insurance companies from basically free riders. In other words, people that are not sick and want to wait until they get sick to enroll in coverage. This is a disincentive for people to wait. Buy health insurance while you're healthy so that when you need it outside these enrollment periods during the rest of the year, you are covered. And that's the idea. So summary and next steps. Starting in 2014, the individual health insurance marketplace will allow individuals to compare and purchase standard individual health plans. The marketplace is going to facilitate the calculation and advance payment of the individual's premium tax credit if applicable. This is a big, big advantage and responsibility of the health insurance marketplace. The employees are only eligible for the premium tax credit if the employer drops coverage. So what I'm outlining here is a potential massive incentive for companies to drop health insurance, especially if they have less than 50 employees, because health insurance on the individual market is now going to be equivalent to group health insurance in terms of scope because of the essential health benefits. Now it's a question of cost. If the tax credit makes individual health insurance cost less than group health insurance, why offer group health insurance? Especially when you factor in the portability of individual products. Finally, employers, employees, and insurance brokers need to understand the marketplace because it may be a better solution than group health insurance. If you're an individual employee and your company offers group health insurance and requires you to contribute, if you want to know the health insurance marketplace because it may be a better deal for you to drop off that plan and go buy coverage. Same for you, employer, and same for you, broker, because all this stuff affects you indirectly once an employee decides to make that decision. So I hope this webinar was helpful. It's a lot of content to try to summarize in a very simple way, but I think we did a fairly good job. I think we can do better in maybe a future webinar, so we'll probably do some follow-up topics to this. But I will go ahead and open it up for questions and answers. So if you need to jump off. Really appreciate your time and look forward to working with you.